Homelessness is a reality that we all hope to never face. From the ages of 19 to 27, homelessness was my reality. Upon my grandmother's husband returning home from prison, I was forced to leave abruptly. I had no control. I had no plan. However, if it wasn't for the permanent supportive housing program providing me the stability that I needed, I wouldn't be here speaking today. With looming federal budget cuts threatening to take away such programs, I want to convince you why government funding should continue to be allocated to housing the homeless. My reasons are that housing the homeless is ethical while also economically proficient. Neglecting to house the homeless leads to premature death amongst the unhoused population. According to a 2018 consensus report written by a committee of professionals in public health, published by the National Academics of Science, Engineering, and Medicine, individuals experiencing homelessness have an average life expectancy between 42 and 52 years old compared to the U.S. average life expectancy of 78.8 years old. The report informs that individuals who live on the street are subject to extremes of the elements: freezing temperatures, extreme heat, rain, lack of places to wash, urinate, and defecate, exposure to violence, victimization, and drugs. In light of these circumstances, chronically homeless individuals are at a higher risk of premature death due to climate changes, infections, traumatic injuries, drug overdose, violence, and high exposure to disease. According to a 2023 systematic review and meta-analysis by researcher Dr. Cass and colleagues in Campbell Systematic Review, case management through the PSH program was found to be an effective means of intervention. The information presented states, case management is a process where clients who have been given permanent supportive housing are assigned case managers who assess, plan, and facilitate access to health and social services necessary for the client's recovery. Dr. Cass found that high-intensity case management reduces the number of individuals homeless after 12 to 18 months by almost half, making the retention rate within this program very high. In light of this data, the evidence concluded individuals involved in the permanent supportive housing program no longer were subjected to barriers in healthcare, thus improving health outcomes and increasing housing stability among said individuals. Furthermore, contrary to the popular belief that housing the homeless exasperates tax dollars, failure to do so actually squanders tax dollars. Referring back to the 2018 consensus report published by the National Academics of Science, leaving the homeless unhoused puts an extraordinary amount of stress on public resources. According to the data, 29% of homeless patients stated that hunger, safety concerns, and lack of shelter were the reasons they came to the emergency department. The report also revealed individuals experiencing homelessness had longer hospitalizations due to the fact that it wasn't humane or safe to discharge them back into the street while undergoing recovery. According to a 2009 peer-reviewed study by behavioral scientist Dr. Lemur and colleagues, the provision of housing reduced hospital visits, admissions, and duration of hospital stays among homeless individuals, and overall public system spending is reduced by nearly as much as is spent on housing. The study informs that homeless individuals use expensive health services at high rates. This includes, but is not limited to, hospital beds, emergency medical services, shelter and sobering center use, and Medicaid-funded services. In contrast, the data concluded that service use and costs dropped by 53% amongst individuals participating in the permanent supportive housing program. In conclusion, today I have provided you reasons why government funding should continue to be allocated to housing the homeless. Housing the homeless is ethical. Housing the homeless is economically proficient. In today's economy, anyone can be homeless next. The next time you're tempted to believe that funding to house the homeless is a waste of money, I want you to remember two things. Funding to house the homeless saves tax dollars, and having the funding there might be the exact safety net of compassion you may need tomorrow if you were to be facing the disparity of homelessness. Thank you.